There are many forms of contraception, but the most natural option is breastfeeding. A mother who continuously breastfeeds her newborn will be prevented from pregnancy for up to 6 months by causing the mother's body to stop producing a hormone that is necessary for ovulation, the release of an egg from an ovary. If the egg is not released from the ovary, sperm cannot fertilize it and pregnancy will not occur. In order for this method to work, the mother must be a woman, become pregnant, deliver a child, and continuously breastfeed her baby for at least every 4 hours during the day and every 6 hours at night. She must not substitute other foods for a breast milk meal. Continuous breastfeeding can be difficult for some mothers. Contact a lactation expert as soon as possible to prevent lactation interruption. For this method to work, she must also not have her period since delivering her baby. When done correctly, only 1 in every 100 women will become pregnant in the first 6 months using this method. About every 2 in every 100 women will become pregnant in the first 6 months if they don't always use this method correctly. By the time her baby is 6 months old, she should start using another birth control method. Breastfeeding is safe, simple, and convenient. The advantages of breastfeeding for mothers are: it does not affect a woman's natural hormone balance. It is immediately effective. It's free. It requires no prescription. Needs nothing to be put in place before vaginal intercourse. Reduces bleeding after delivery. Requires no supplies or medical supervision. And it can help you lose weight after the baby is born. Still, breastfeeding can be challenging. Breastfeeding also has many health advantages for the baby. It decreases the likelihood of infection from germs in water, other milk, or formula. Increases body contact and enhances comfort for the child and bonding between mother and child. Passes on some of the mother's antibodies to protect the baby from certain infections. Protects against the development of allergies and may protect against the development of asthma. It also provides the best nutrition for the baby, and breast milk is easier to digest than commercial formula. The disadvantages for breastfeeding are: you can only rely on breastfeeding to prevent pregnancy for 6 months. Some women find it hard to exclusively breastfeed and not use any formula. If formula is given to the baby, the woman has a chance of getting pregnant again. Breastfeeding may reduce vaginal lubrication when a woman is aroused. It may also make a woman feel like her breasts are less sexual. Keep in mind that breastfeeding does not protect you from sexually transmitted diseases. Reading about breastfeeding is one thing, doing it on your own is something else. The first time you breastfeed your baby, preferably within the first hour after delivery, ask for help. The maternity nurses or hospital lactation consultant can offer breastfeeding tips, starting with how to position the baby and make sure he or she is latching on correctly. Your doctor or your baby's doctor might offer breastfeeding tips too. Start by getting comfortable. Support yourself with pillows if needed. Then cradle your baby close to your breast, rather than bending over or leaning forward to bring your breast to your baby. Support your baby's head with one hand and support your breast with the other. Tickle your baby's lower lip with your nipple. Encourage your baby's mouth to open wide, and he or she will take in part of the darker area around the nipple called the areola. Your nipple will be far back in the baby's mouth, and the baby's tongue will be cupped under your breast. Look and listen for a rhythmic sucking and swallowing pattern. If you need to remove the baby from your breast, first release a suction by inserting your finger into the corner of your baby's mouth. For the first few weeks, most newborns breastfeed every 2 to 3 hours round the clock. Watch for early signs of hunger such as stirring, restlessness, sucking motions, and lip movements. Let your baby nurse from the breast thoroughly until your breast feels soft, typically about 20 minutes. Then try burping the baby. After that, offer the second breast. If your baby's still hungry, he or she will latch on. If not, simply start the next breastfeeding session with the second breast. If your baby consistently nurses on only one breast out of feeding during the first few weeks, pump the other breast to relieve pressure and protect your milk supply. Hold off on a pacifier. Some babies are happiest when they're sucking on something. Enter pacifiers. But there's a caveat. Giving your baby a pacifier too soon might interfere with breastfeeding, since sucking on a breast is different from sucking on a pacifier. The American Academy of Pediatrics recommends waiting to introduce a pacifier until breastfeeding is well established, usually 3 to 4 weeks after birth. Avoid pacifiers shortly after birth can help protect your milk supply as well as promote healthy weight gain for your baby. Take our quiz online at PlannedParenthood.org to see which form of contraception is right for you.